A study published just last year in the Mayo Clinic Proceedings describes something that stopped me cold. A man in his 60s, diabetic, dealing with high blood pressure for years, walked into his doctor's office for a routine checkup. His doctor looked at his hands, not his chart, not his blood work, his hands. And what she saw on his fingernails told her his kidneys were failing before a single lab test confirmed it. Think about that for a moment. His nails knew something his blood tests hadn't caught yet. I'm Dr. Elizabeth Blackwell, and after 7 years of practicing medicine and following the latest research closely, I need to share something with you that could genuinely change how you monitor your own health. Because here's what most people don't realize: your fingernails are not just keratin and cosmetics. They're a 24/7 status report on what's happening inside your body right now as you're watching this. Your heart, your kidneys, your liver, your lungs, they're all sending signals to the tips of your fingers. And most people have no idea how to read them. By the end of this video, you're going to know exactly what to look for when you examine your own nails. 5 specific signs, each one connected to either your kidneys or your heart. And I'm going to show you the exact next step to take if you spot one of these warning signals. But before I walk you through each sign, you need to understand why your nails reveal what's happening deep inside your organs. Because without that context, you might panic over something harmless, or worse, you might dismiss something that actually matters. Then, in the second half, I'm going to give you a simple self-check protocol you can do in under 2 minutes at home for free. And I'll tell you precisely which blood tests to request if you see something concerning. If this topic hits close to home for you or someone you love, drop a comment below and let me know. Because what I'm about to share could be the difference between catching a problem at stage 2 and catching it at stage 4. Let me tell you about a patient I'll call Dorothy. Dorothy was 73 years old, retired school teacher, lived alone in a small house with a garden she loved. She was meticulous about her health, took her blood pressure medication every morning at 7 a.m., saw her doctor twice a year for checkups, walked around the block 3 times a week. Her last set of labs? Perfectly normal. Creatinine in range. GFR looked fine. Her doctor even told her, "Dorothy, whatever you're doing, keep doing it." That was in March. By June, Dorothy started noticing something strange. Not pain, not fatigue, something much more subtle. When she was watering her tomatoes one morning, she looked down at her hands and noticed her fingernails looked different. The bottom half of each nail, the part closest to her knuckles, had turned completely white, a milky opaque white, but the top half? Still that normal pinkish color, almost like someone had drawn a line across the middle of her nail. She figured it was just age. Maybe she wasn't getting enough protein. Maybe she needed a manicure. She didn't mention it to anyone. For months later, Dorothy collapsed in her kitchen. Her husband had passed years ago. She lay on that floor for 6 hours before her neighbor noticed the newspapers piling up on the porch. When the paramedics arrived, one of them, a young EMT who had paid attention in his training, looked at her nails. And he said 4 words that changed everything. Check her kidney function. Dorothy's kidneys were failing. Stage 4 chronic kidney disease. Her GFR had dropped from normal to 22. Her creatinine had tripled. And nobody knew, because between her March appointment and her collapse, nobody had ordered labs. Nobody had looked closely at her hands. Those half-and-half nails? They're called Lindsay's nails, named after Dr. Philip Lindsay, who first described them in 1967 at the University of Iowa. And according to research published in PMC, they can be found in up to 40% of patients with chronic kidney disease. 40%. That's not a rare curiosity. That's almost half of everyone walking around with failing kidneys. And most of them, like Dorothy, have no idea what their nails are trying to tell them. I want you to understand something important here. This is not about blaming Dorothy. This is not about blaming her doctor. Guidelines update slowly. Appointments are rushed. The system doesn't give physicians the time to examine every detail the way they want to. That's exactly why this video exists. Comment yes below if you've ever noticed unusual color changes in your nails and didn't know what they meant. I want to see how many of you are in this situation right now. Now let me explain what's actually happening inside the body when these nail changes appear. Because this is the part that will help you distinguish between something harmless and something that needs attention. Your nails grow from a structure called the nail matrix. It's located right underneath your cuticle. Think of it like the root system of a plant. Whatever is happening in your bloodstream, whatever waste products are building up, whatever nutrients are missing, it all shows up in the nail matrix. And then, as the nail grows out, roughly 1 millimeter every 6 to 10 days, those changes become visible. It's like a slow-motion health diary. When your kidneys start failing, they can no longer filter waste products from your blood efficiently. Toxins build up. Hormones go haywire. One particular hormone, called beta-melanocyte-stimulating hormone, increases dramatically, and that hormone affects pigmentation. This is why Lindsay's nails appear the way they do. That white proximal band happens because blood flow to the nail bed changes. That reddish-brown distal band? That's from increased melanin production. The sharp line between them? That's the moment your kidneys started struggling. Here's what most people don't realize. These changes can appear months before your blood work shows anything alarming. A case report published in Clinical Case Reports in 2021 described a 50-year-old woman with poorly controlled hypertension who showed up in the emergency room with a seizure. Her doctors were initially puzzled. But one physician looked at her hands, saw Lindsay's nails, and immediately suspected chronic kidney disease. They were right. Her kidneys had been silently declining for years. The nail changes appeared long before the crisis. Now, you might be thinking, okay, but how do I know if what I'm seeing is Lindsay's nails versus just weird nails? Let me give you the specific criteria. Lindsay's nails have a sharp horizontal line dividing the nail into two distinct zones. The bottom half, closer to your cuticle, is white or pale. The top half, closer to your fingertip, is red, pink, or brown. And that top section takes up anywhere from 20 to 60% of the nail length. This pattern should appear on most of your fingernails, not just one. If it's only on one nail, that's more likely trauma. Maybe you slammed your finger in a door. And critically, this pattern does not move as the nail grows out. It stays fixed relative to the nail bed. That's the key difference from some other nail changes. If you're looking at your hands right now and you see this pattern, don't panic. But don't ignore it either. I'm going to tell you exactly what to do about it in a few minutes. First, let me walk you through the second sign. This one points to your heart. Terry's nails. Named after Dr. Richard Terry, who first described them in 1954 while studying patients with cirrhosis. But here's what most people don't know. Terry's nails aren't just a liver thing. According to research published in the American Journal of Medicine, they're also strongly associated with congestive heart failure and chronic kidney disease. So what do Terry's nails look like? Imagine looking at your fingernail and seeing almost the entire nail bed turn white. Not a healthy pink with a white moon at the bottom. White, ground glass opacity, like someone frosted your nail from the inside. And then at the very tip, just a narrow band, maybe 1 to 3 millimeters, you see a thin strip of pink or brown. That's Terry's nails. The Cleveland Clinic explains that this happens when there are fewer blood vessels supplying the nail bed. The tiny capillaries that normally give your nails that healthy pink color, they've been replaced by overgrowth of connective tissue. Blood flow is reduced, and the nail bed literally loses its color. In patients with congestive heart failure, this makes perfect physiological sense. When your heart isn't pumping efficiently, blood flow to the extremities decreases. The fingers are the last stop on the circulation train. They're the first to show signs of reduced perfusion. Now here's the nuance that could save you from unnecessary worry. Terry's nails can appear as part of normal aging. In people over 80, it's fairly common and may not indicate anything serious. But if you're in your 60s or 70s and you notice this change, especially if it came on relatively recently, it's worth getting your heart function checked. A simple echocardiogram can tell you if your heart is pumping the way it should. Comment rethinking below if this is making you look at your nails in a completely different way. Let me give you the third sign now. And this one is critically important because it's been recognized since the time of Hippocrates, over 2,400 years ago. Nail clubbing. This is one of the oldest physical exam findings in medicine. Hippocrates himself described it in patients with emphysema, an infection in the lining of the lungs. And today, it remains one of the most significant nail changes a doctor can observe. What does clubbing look like? Your fingertips enlarge and become bulbous, almost like the end of a drumstick. Your nails curve downward, wrapping around your fingertips like the edge of a spoon. And when you press on the nail bed, it feels soft and spongy, like you're pressing on a cushion. There's a simple test you can do right now. Put your 2 index fingers together, nail to nail, with the nails facing each other. If your nails are normal, you should see a small diamond-shaped gap between them, right at the base of the nails. This is called Shamroth's window. If that diamond-shaped gap is gone, if your nails press completely flat against each other with no space between them, that's a positive Shamroth sign. And it suggests clubbing. According to StatPearls, a comprehensive medical reference updated regularly by the National Institutes of Health, clubbing is seen in roughly 1% of all internal medicine hospital admissions. And of those patients, 40% have a serious underlying disease. The most common cause? Lung cancer. In fact, roughly 80% of clubbing cases related to thoracic malignancy are caused by lung cancer specifically. But clubbing is also associated with congenital heart defects that cause low oxygen levels, infective endocarditis. That's an infection of the heart valves, interstitial lung disease, cystic fibrosis. Inflammatory bowel disease. The mechanism behind clubbing involves increased blood flow to the fingertips. Growth factors like PGF and VEGS get released, possibly due to low oxygen levels or abnormal blood flow patterns, and they cause the soft tissue to expand. Here's the key point. If you notice your fingertips becoming rounded and bulbous, especially if it's happening on multiple fingers and developing gradually over weeks or months, do not dismiss this. See your doctor. Get a chest X-ray. Ask for further evaluation. Now let me show you exactly how to perform a nail self-examination at home. This is the protocol I want you to use. First, find good lighting. Natural daylight is best. Stand near a window. Second, remove any nail polish. You need to see your actual nail bed, not what's covering it. Third, examine each fingernail, one at a time. Start with your thumbs and work outward. For each nail, ask yourself, 1. Is the nail plate uniform in color, or is it divided into 2 distinct zones? If you see a sharp horizontal line with white below and dark above, that's consistent with Lindsay's nails. 2. Is most of the nail white or washed out, with just a thin dark band at the tip? That's consistent with Terry's nails. 3. Does the nail curve downward excessively? Do your fingertips look swollen or bulbous? Perform the Shamroth window test. Nails together, nail to nail. Is the diamond gap present or absent? 4. Do you see any thin red or brown lines running vertically under the nail? Not across, but up and down, in the direction of nail growth. Those could be splinter hemorrhages. 5. Do you see any horizontal grooves or ridges running across the nail from side to side? Those are Beau's lines. Let me explain those last 2 signs because they're also important. Splinter hemorrhages look exactly like what they sound like, tiny splinters embedded under the nail. But they're actually small areas of bleeding in the capillaries beneath the nail bed. When these appear without any history of trauma, you didn't bang your finger, you didn't injure your nail, they can indicate a serious condition called infective endocarditis. That's a bacterial infection of the heart valves. According to research published in the Journal of General Internal Medicine, splinter hemorrhages are found in 15 to 33% of patients with endocarditis. The infection throws off tiny clots called septic emboli. These travel through the bloodstream and lodge in the small blood vessels under the nails, causing localized bleeding. If you see splinter hemorrhages on multiple nails and you're experiencing fever, fatigue, night sweats, or a new heart murmur, that's a medical emergency. Endocarditis can be fatal if untreated. But here's the important nuance. Splinter hemorrhages are much more commonly caused by simple trauma. If you work with your hands, garden, or use tools, you probably get minor splinter hemorrhages all the time. The key is whether they're appearing on multiple nails simultaneously and whether you have other symptoms. Beau's lines are different. These are horizontal grooves that run across the nail, not vertical like splinter hemorrhages, but sideways, from one edge of the nail to the other. They indicate that something interrupted your nail growth temporarily. According to the Cleveland Clinic, Beau's lines can be caused by severe illness or high fever, major surgery, heart attack, chemotherapy, severe emotional stress, uncontrolled diabetes. Peripheral artery disease. The nail matrix essentially goes into shutdown mode during a physiological crisis. It stops producing nail cells for a while, and when growth resumes, there's a visible dip or groove marking that moment. Here's the fascinating part: because nails grow at a predictable rate, about 1 millimeter per week, you can actually estimate when the stressful event occurred by measuring how far the Beau's line is from your cuticle. A line 6 millimeters from your cuticle suggests something happened about 6 weeks ago. This is like reading the rings of a tree trunk. If you see Beau's lines and you know what caused them, a recent hospitalization, a bad bout of flu, a surgery, then there's nothing to worry about. The lines will grow out over a few months and disappear. But if you see Beau's lines and you don't know what caused them, that's worth investigating. It could be a sign of an undiagnosed condition affecting your circulation or metabolism. Comment taking action below if you're planning to do this nail self-check today. I want to hear from you. Now, let me share a different story. This one ends better. Her name was Evelyn, 71 years old, retired nurse. She'd spent 40 years caring for other people, and now she was finally paying attention to herself. One morning, while trimming her nails, she noticed something odd. Several of her nails had that half-and-half appearance, white near the base, darker near the tip. She remembered something from her nursing training, decades earlier. Something about kidney disease and nail changes. Most people would have brushed it off, but Evelyn did something different. She made an appointment with her primary care doctor. She walked in with a list. She said, "I want my kidney function checked. I've noticed changes in my nails that concern me." Her doctor was initially skeptical. Evelyn's last labs had been fine. She had no symptoms. But Evelyn insisted. "Just humor me," she said. The results came back 3 days later. Her GFR had dropped to 42. That's stage 3 chronic kidney disease. Asymptomatic. Silent. Caught only because Evelyn knew what her nails were telling her. Her doctor adjusted her blood pressure medications, started her on a kidney protective diet, ordered follow-up tests every 3 months instead of every year. 5 years later, Evelyn's kidneys are stable. She's not on dialysis. She's still gardening, still walking, still living independently, because she noticed. And she acted. So, what exactly should you do if you see something concerning? Step 1. Don't panic. Many nail changes are completely benign. Fungal infections, minor trauma, normal aging, these can all cause nail abnormalities that mean nothing serious. Step 2. Document what you see. Take a photograph in good lighting. Note the date. Step 3. Make an appointment with your doctor. Bring the photograph. Be specific about what you've observed. Step 4. Request appropriate testing. If you're concerned about kidney function, ask for a comprehensive metabolic panel that includes creatinine and BUN. Ask for an estimated GFR. If you have risk factors for kidney disease, diabetes, high blood pressure, family history, these tests should be routine anyway. If you're concerned about heart function, ask about an echocardiogram. Ask about a BNP level, which can indicate heart failure. If you see clubbing, ask for a chest X-ray and pulse oximetry to check your oxygen levels. Step 5. Follow up. Don't let abnormal results fall through the cracks. If something is found, make sure you understand the next steps. If nothing is found, continue monitoring. Now, I want to be clear about something important. This information is designed to help you have a more informed conversation with your doctor, not to replace their guidance. Always discuss changes with your healthcare provider. Bring this information to your next appointment and work together. Not everyone who has unusual nail changes has organ failure. Normal aging causes nail changes. Fungal infections cause nail changes. Vitamin deficiencies cause nail changes. The goal here is awareness, not anxiety. If you're already under the care of a nephrologist or cardiologist for known disease, Follow their guidance. This video is about catching problems early before you even know you have them. And if you found this genuinely valuable, consider using super thanks below. It highlights your comment so my team can prioritize responding to your specific health questions. For those of you who want this entire protocol in a printable format you can literally hand to your doctor at your next appointment, that's available to our Pure Longevity VIP members. The link is in the description. VIP members also get priority responses to their health questions. Let me leave you with this. Your body is constantly communicating with you through fatigue, through appetite changes, through sleep patterns, and yes, through your fingernails. Most of us have been trained to ignore these signals, to push through, to assume it's nothing. But the research is clear. Nail changes can precede blood test abnormalities by months. They can serve as early warning systems for kidney disease, heart failure, lung problems, and infections. The question isn't whether your nails have information to offer. They do. The question is whether you're paying attention. Look at your hands right now. Really look at them. What are they trying to tell you? Comment one of 3 things below. Healthy nails if everything looks normal after your self-check, seeing a sign if you notice something that concerns you, or making an appointment if you're planning to follow up with your doctor. I read every single comment, and I want to know where you stand. Share this video with someone you love who needs to see this. A parent, a spouse, a friend who's been ignoring their health. Because sometimes, the most important medical information comes from the most unexpected places. Your nails are talking. Are you listening? I'm Dr. Elizabeth Blackwell. Thank you for watching. Take care of yourself. I'll see you in the next video.